我们能做的其实就是等待吧，等待通知，等待解封的那一天。
Is Wuhan's past our present, and could Wuhan's present become our future? This is Yinan's lockdown diary, filmed for Channel 4 News from beginning to end, all 76 days of it.
等待更多人被治愈的那一天，等待不停的有好消息传来的那一天。这是我们家客厅，每天就是把电视放着，轮播这个新闻频道。基本上每天都待在家里，除了上次出去买了一趟菜之外呢，就没有出过门了。
A few short weeks ago, a population reduced to hermit status and deserted cities still seemed alien to the UK. And then we too became Wuhan.
现在这条街上的各种店都已经关门了，没有人了。大家感觉超市还挺多人的，你这大家都在囤东西。
There are some parallels with our experience. The supermarket packed with panicked shoppers on day 3 of the lockdown. And just like here, the authorities in Wuhan clocked the lack of social distancing and the continuing movement of people. So they decided to act. 1 month in, and the lockdown in Wuhan became locked in. Homes were cut off. Forget Ocado. Here, food supplies were delivered and distributed like rations by volunteers organized within housing estates.
然后每个居民不同的快递包裹会堆放在这里，大家就是可以来拿。这个是拍摄的时候无意中的一个团菜的来了，然后现在他们手上会一一通知居民分批下来拿。差不多就是这个样子，因为楼下的站点的人是不让出这个黄色的，所以可能我拍不到就是特别多的街景吧。然后路上的情况没有什么车。
By now, Yinan had started work as a community volunteer. Her job, to take the temperature of everyone in her apartment complex. Those with high temperatures were given a red status and immediately quarantined, then sent to outside hospitals for further testing and treatment.
你也是开明吗？
我打针。
和社区的联系过吗？
联系过。我昨天跟社区联系了。
昨天社区吧。
All this personal health data is accessed through the popular WeChat social media app used by over 1 billion Chinese. And everything on WeChat is also seen by the government in real time. Highly intrusive real-time tracking of a largely compliant population. That was the key to the eventual lifting of the lockdown in Wuhan. After 76 days, the lockdown was finally over. With her health status listed as green on her phone, Yinan was allowed back to work.
好，谢谢您。
4月8号解除离汉通澳管控措施之后的各项工作，强调要坚持防控不松懈，确保疫情不反弹。新华社消息，最高检公安部。
Post-lockdown Wuhan is in many ways stricter than the UK in our existing lockdown.
然后到达公司之后呢，公司会给大家准备这个温度枪测量自己的体温，然后填一张这个样子的表。
The smartphone and the obligatory WeChat app is the people's passport to normality, or a degree of it. Fail a temperature test, get a red status, and you're back in personal lockdown and immediately re-quarantined. Restaurants, shopping malls, schools and colleges all remain shut, and all public exercise is still forbidden. In reality, post-lockdown life here has a long way to go before it gets back to normal.
Well, earlier today, I spoke to Dr. Keiji Fukuda in Hong Kong. He worked for the World Health Organization as Assistant Director General of Health Security. And I asked him where he thinks we are now with this outbreak globally.
Well, I think that we're still at the early stages of this outbreak unfolding. You know, we'd all like to think that we're getting close to the middle or close to the end. But I think that we're just beginning to see activity increase in Africa. And we have seen high levels of activity occur in places like North America and the US. And I think the likelihood is that even in countries which have experienced significant activity, we're going to continue to see waves of activity as we go forward.
And what do you make of the increase in the Chinese numbers? I mean, are these sorts of increases with time inevitable, or has there been some funny business going on?
No, I think that it's inevitable that our understanding of the number of deaths is going to increase. So for example, in New York City, we saw that the number of deaths increased because they said lots of people never made it to the hospital, or they died in emergency rooms before they could be seen. And similarly, the Chinese have added a large number of deaths in Wuhan. But going forward even further, it's inevitable when we look back to this period and use other means like estimating excess deaths, that we're going to find out, in fact, the number of deaths is much greater than we are counting right now.
If we are still at the early stages of this disease, I mean, is it simply too soon to be talking about trying to return to some sort of normality?
I don't think it's too early to be talking about it, and in some instances acting upon it. We can't wait until the outbreak fully disappears. But on the other hand, I do think that it's incumbent upon governments not to paint a picture which is not really based in reality for the people living in those countries, and to make it seem as if it's a simple matter of simply deciding that there is a date by which you're going to open up the economy.
So the idea of Donald Trump basically saying America needs to get back to work and we'll do it in phases is just unrealistic.
Well, I think it's realistic to say that America has to get back to work because every country wants to get back to work. It doesn't make sense to go back to normal levels of activity if disease levels are going up. So you do want to make sure things are going down.
Now, as a former WHO official, I mean, is it fair, do you think, to criticise the WHO for its early response? Was it confused?
I think it's going to be fair to criticize everybody. WHO, countries. I don't think there's any country that is not going to have to go back and look at itself and say, did we do things right? Could we have done better? And I think that's also true for WHO. But I think we do need the organization. It is truly unique and central. We do need global leaders around the world who rally around it because there is nobody else who can do the same job as WHO.
I mean, when we look back on this, do you think we will say those Asian countries who had learned from the SARS and MERS outbreaks were better prepared? They were able to adapt more quickly?
In Hong Kong, where I am now, the government went ahead to strengthen its health systems. It went ahead to strengthen its scientific systems related to emerging infectious diseases. It took a lot of steps like that. And the public itself made changes in society.
Professor, thank you very much indeed for your time.
Thank you.